Opioids by Lydia Whip, Rachel Smith, Evan Davis, Nate Kreckler, and Isabella LaPista. Our driving question is, how can we best regulate opioid use and decrease abuse? As we present this information to our peers, the main obstacle we need to overcome is the question of, why should we care? Have opioids invaded our lives enough? They have. Popular culture forces you to find relevance within it. Famous rapper Lil Peep overdosed on fentanyl and Xanax, as did Mac Miller and Prince. Endless lyrics are written by their peers, glorifying these substances that are actively killing them and others. Painkillers are a big part of our lives. We found a strong correlation between athletic injuries and teen opioid use, with over 30 million teens participating in sports and 3.5 million of them getting hurt annually. Opioids are prescribed in droves, and chronic headache numbers are high, and even though these medical professionals are not supposed to, 46% of the children out of a completed study were also prescribed opioids for their chronic headaches. In substance abuse, poisonings by prescription opioids largely impact both young children and adolescents, almost targeting them. If it isn't because of physical pain, then it's because of emotional pain they're experiencing. And both are equally real to us. In 2015, 276,000 adolescents were current non-medical users of a pain reliever, with 122,000 admitting to an addiction to them. In 2015, also an estimated 21,000 adolescents had used heroin in the past year. An estimated 5,000 were current heroin users. Finally, if it isn't emotional pain, then it's pressure or simple ignorance. Don't even think about it, even though it's in the media everywhere you look. And even though 34.6% of us have prescription opioids in our homes, education is the first thing we can do for you. Slide.
Okay. I guess I can do learning target.
Learning target.
Yeah. Yeah. Learning targets. What are opioids and what are their impacts?
Vocabulary. Definition of opioid: an addictive drug that numbs pain and provides relaxation. Morphine is an opioid pain number.
Mic off.
Naloxone reduces the effects of an opioid overdose, and heroin is an illegal opioid drug. The CDC stands for the Center for Disease Control and Prevention. Synthetic opioids are those that are made in a laboratory, while non-synthetic opioids are naturally found. Fentanyl, a synthetic opioid pain reliever. Codeine treats mild to moderate pain while still being an addictive opioid. Benzodiazepine, or benzos for short, are an opioid sedative used to treat insomnia and anxiety. Demerol is another opioid painkiller that is very easy to get addicted to. Oxycodone treats moderate to severe pain, and since it's an opioid, it's easy to get addicted to. Noticing a theme? Hydrocodone is an opioid to treat severe elongated pain as well as coughing in adults. It is addictive as well. Slide. History and background. Opioids were first used to treat soldiers during the Civil War, and this got them addicted to opioids. In 1909, Congress passed the Opium Exclusion Act, which barred the smoking of opium and was sort of the start on the war on drugs. In 1914, opioids were taxed and regulated by the Harrison Narcotics Tax Act. In 1970s, doctors started to stop prescribing opioids due to the stigma about causing addiction around them. But in the 1980s and 1990s, opioids were starting to be prescribed by doctors again. Morphine was discovered by a German pharmacist, Friedrich Serturner, in the early 1800s. After the hypodermic needle was invented in 1853, morphine began being used in minor surgical procedures. Morphine was also administered to middle-class citizens with depression or veterans with PTSD, getting them also addicted. Thanks to the morphine epidemic caused by these administrations of morphine, the Bayer Corporation introduced heroin, another opioid, in 1898, in attempts to replace morphine and also capitalize on that sweet money profit and the need for opioids. It was advertised as a non-addictive drug, but in actuality, it was addictive.
Statistics. Important statistics on opioid use include the fact that in 2016, the number of opioid prescriptions had increased to 236 million after a peak of 282 million in 2014. So are Americans in any more pain than they have been in the past? Not likely. The CDC guidelines for prescribing opioids offers us comprehensive data to show that opioids are a major cause of death in America. There have been about 115 deaths a day on average since 2014. This adds up to say that since 1999, there have been 165,000 deaths due to overdose of just prescription opioids. And within the past month, 4.3 million Americans engaged in non medical use of opioids. We understand that where you get the drugs matters very little to the fate you can come to. Addiction on its own is a pain and a disease. 80% of people suffering from an addiction to heroin started with a prescription for an opioid pain reliever. Studies. The POATS, Prescription Opioid Addiction Treatment Study, is a study that analyzed data from at least 10 different programs around the world. They tried to study if people who had gotten additional drug counseling to prescription use of their opioids would relapse after 4 weeks of being on the drug and 8 weeks of tapering off of it. Also, it tested the reduction of chronic pain within the use of naloxone. The test subjects who had used heroin 5 days or sooner were excluded, and they met a lifelong diagnostic criteria for opioid dependence from heroin. They had injected heroin, and those that had injected heroin were excluded from the test. Over 40% of the users that were addicted had chronic pain.
Myths about opioid. Myth number 1, opioid addiction is just a psychological disorder and people who are dependent simply need more. Opioid addiction is more than just psychological or a weakness of character. It has to do with withdrawal, tolerance, and brain. In the words of Richard Schottenfield, a doctor of medicine and psychiatry, opioid use disorder is defined as a loss of control over use of. This means that the person continues to use opioids despite negative consequences or is unable to stop using them despite one. Myth number 2, the best way to combat an opioid addiction. This is mostly untrue, as most people in abstinence-only programs. Addiction is best treated by a combination of medication and methadone and buprenorphine are the two most common medications used to treat addiction because they address patients' withdrawal symptoms and block the reward or the high people get from using. Myth number 3. It's okay if we call people with opioid use disorder addicts, junkies, or users. These names add to the stigma surrounding people with opioid use disorder, as well as phrases like needs to get clean. Jeanette Tetrault, a doctor of medicine and internal medicine, stated that studies have shown that people who were referred to as substance users are more likely to be considered a threat or be responsible for the condition, whereas people who were referred to as having substance use disorder were more likely to be seen as needing help. The way we address the issue has a lot to do with the word we use for it. Myth number 4. If you take opioid pain medications for a valid reason, you can't get addicted. Anyone can develop an addiction to opioids, especially when taken over long periods of time. It's important to use them as prescribed.
Current events. COVID-19 has caused a reduction in access to life-saving services like naloxone and opioid use recovery services. However, COVID has also provided benefits to combating drug use. With the forced isolation, individuals have been having a harder time getting to drugs and therefore hindering their addiction. It's similar to forced sobriety. Pre-COVID-19, we saw an increase of opioid use in rural areas, and Medicaid expansion with the Affordable Care Act's help has reduced opioid overdose death by 6% in states that expanded. Joe Biden, our 46th president, is going to offer rehabilitation and treatment for opioid users and other drug users instead of focusing on law enforcement. 343 Minnesotans died from an opioid overdose in 2018, and of the 343 deaths, 202 were from synthetic opioids, think fentanyl. 136 were from prescription opioid deaths, and the last 93 were heroin-caused deaths. Fentanyl, a narcotic for treating severe pain, is a highly addictive substance. The American Medical Association is concerned about the increased production of illegal fentanyl causing overdoses and deaths. 88% of fatal opioid overdoses in Vermont were caused by fentanyl.
Minnesota Adult and Teen Challenge. Adult and Teen Challenge is an organization that focuses mainly on helping people who are struggling with drug and alcohol addiction. They do also have special opioid sections dedicated to helping people with opioid addictions. They also help provide affordable licensed treatments along with a multitude of other forms of help like faith-based recoveries and convenient outpatient programs. Considering that opioids are one of the drugs that are a lot easier to get compared to like marijuana or cocaine, which are much more illegal per se, and the fact that almost 50% of deaths caused by opioids are from drugs that have been prescribed by a doctor, Minnesota Adult and Teen Challenge are a very, very big help in cutting down and providing a safe outlet to people who are struggling with addiction. AddictionCenter.com is a website that provides links to treatment centers across the entire country. On their website, they have a tab for every state in the country, where when you click on it, you get taken to a search engine, basically, and you find your city. Once you have found your city, the website gives you an entire article about what the best treatment centers are and other information such as where you can find them. They also provide very insightful articles with topics relevant to that city or that state. For example, when you click on Minneapolis, they have a very insightful article about the opioid crisis in Minneapolis. This website is a haven for anything and anyone related to opioids and what they are struggling in.